Good day everyone, I am Michelle Jane Sevilla from Group 20 and today I am going to perform Leopold's Maneuver return demonstration. So Leopold's Maneuver is used to systematically palpate the gravid uterus. It is a non-invasive method to determine the position, presentation, and engagement of the fetus inside the uterus. So Leopold's Maneuver is done after 36 weeks gestation to help the expectant mother to be prepared for the labor, and it is also help in determining if there is a need to do for a cesarean section. So prior to the conduct of the procedure, I prepared the necessary equipment needed, which includes a pillow, towel, and a stethoscope. And next, I will perform hand hygiene to protect my patient and myself from infection and cross-contamination. So, good afternoon, ma'am. I am Michelle Jane Sevilla, your student nurse for today. And how are you feeling right now? Alright, that's good. And also, may I see your wristband, please? And kindly state your name and your birthday. Alright, so ma'am, today we will be doing Leopold's Maneuver. So this is done in order to determine the position of your baby inside your uterus, okay? And later I will palpate your abdomen and add a little pressure in it to determine the position of your baby. Will that be alright? Now allow me to close the door so that no one from the outside will be able to disturb you while we're doing the procedure. So before we begin, ma'am, I encourage you to urinate first. So an empty bladder promotes comfort and allows for a more productive examination. On the other hand, a distended bladder may obscure the fetal contour and may slightly deviate the uterus. So, ma'am, are you done with voiding? Alright, I need you to lie down and slightly flex your knee. So this is to relieve the tension and the abdominal musculature. And also, ma'am, can you turn a little so that I can place this towel under your right hip? This is to shift the uterus away from large blood vessels and thus prevent supine hypotensive syndrome. So to begin the procedure, expose only the area of the examination, and if right-handed, stand on the patient's right side. So proceeding with the first maneuver, or the fundal grip. So now face the patient and palpate the uterine fundus to determine what part of the baby lies on the upper part of the fundus. It may be the fetal head or the bridge. And the fetal head feels round, hard, and freely movable, while the bridge feels softer and modular. So this time, I'm going to proceed with the second maneuver, which is called the umbilical grip. So what I'm going to do is palpate in a downward direction on the sides of the abdomen, applying gentle but deep pressure to determine the position of the fetal extremities, the fetal back, and the anterior shoulder. And that's it. So now I'm going to proceed to the third maneuver, which is called the LEOPOLD'S grip. So to do this, I'm going to place my one hand over the symphysis pubis and grasp the lower uterine segment between my thumb and fingers to feel the presenting part. So the presenting part is engaged if it is not movable, and it is not yet engaged if it is still movable. Now with the fourth maneuver, which is called the pelvis grip, I'm going to turn and face the mother's feet to confirm the findings of the third maneuver and determine the flexion of the vertex. So the bra should be on the opposite side of the back. Advocate again for the fetal back and place the stethoscope over it and listen for the fetal heart tone for 1 full minute. Okay, so mom, now we're done with the procedure, and I'm going to remove first this towel, and now I'm going to cover it up so that you will feel comfortable. Okay, so are you all good now? That's good. Okay, so mom, after doing the procedure, I have determined that your baby is in a vertex cephalic position, which means that the head of the baby is at the lower part of your uterus, and it's completely flexed and is already engaged. And this is an ideal position for baby for the labor. And when I was listening to your baby's heart sound, I counted the heart rate at 125 beats per minute, and it was within the normal range. So do you have any more questions, mom, before I go? Okay. And after doing the procedure, perform hand hygiene and documentation of the findings.